Good afternoon. Welcome to our April 10th agenda session. I have some good news. I believe, if I'm not mistaken, we've read everything already into the record on here, or have we? Well, we got a final reading about A and B. I know we've read those already. The first readings, I think we read, and did we talk about A already somewhere, or do we need to read it? Yeah, well, anybody want to approve the minutes? You can tell I'm getting out of here tonight. Okay, we have a motion and a second. Approve minutes. All those in favor say aye. Aye. Opposed? Thank you. So it's revised, so why don't you go ahead and read 6A.
An ordinance amending Chattanooga City Code Part 2, Chapter 11 by the addition of the new Article 17 entitled Small Business Construction Mitigation Grant Program, and to amend ordinance known as FY 2018 Budget Ordinance so as to reappropriate $19,000 from the Department of Economic and Community Development for use in the Small Business Construction Mitigation Grant Program to the Industrial Development Board.
All right, I see no questions. Well, we have read these planning
Chair.
ordinances into the record. Yes? Oh, Councilman Smith.
You're fine, sir. Is this the item we discussed earlier that the amount was changing, Wade?
I'm sorry, could you repeat the question?
Is this the item we discussed earlier where the amount was changing?
That's
I
correct.
believe was. Is that correct?
Yeah.
Okay. But I asked earlier if this needed to be done by motion and amending what was currently there. Are we okay changing it as it is on here, or should it remain original and make an amendment?
No, for notice purposes, let's make the amendment tonight, if that's okay.
I would prefer
Yeah,
that to
yeah.
be in proper terms. So this needs to be readjusted, and then the amendment needs to be made tonight.
Yeah, that'd be great.
Thank you.
Thanks.
Thank you. Thank you, Councilman. All right, the planning was read. I'll tell you what was not read last Tuesday, and we need to read it. C, please.
An ordinance to amend Chattanooga City Code Part 2, Chapter 38 zoning ordinance so as to rezone properties located in the 700 to 800 blocks of Franklin Street and two unopened streets, more particularly described herein, from RN residential zone to RTZ residential townhouse 0 lot line zone.
All right. Everything else was read last week. Let's see, did we read resolutions 7A, B, and C last week? I believe we did, didn't we? Okay. Did we read D? I don't think we read D last week, did we? Please read D.
A resolution authorizing the appointment of Prince Muhammad as a special police officer unarmed for the McCamey Animal Center to do special duty as prescribed herein, subject to certain conditions.
All right, and then we move back into planning, which we read last week. Public Works, we read last week in the committee meeting, didn't we, Madam Chair? And I believe we read the transportation last week also, didn't we? All right, that's that. It says none on department reports, but we do have a department report today. It's from Public Works Department.
Thank you, Mr. Chairman. Council members, we're always excited to come to you and update you on some things that Public Works are doing. We get to do that a lot of times during the agenda sessions and during our committee. But we'd like to take this opportunity to kind of get into to projects or successes that the department experiences throughout the year. One of the things that we've been working on in water quality is a level of service and cost of service rate study. Our water quality division in engineering has employed HDR, and we have several individuals this morning or this afternoon who are going to talk about just an educational session for you all, what we've been doing and kind of the next steps to the project, and ultimately how this affects how we service and serve the public in the permit that the city maintains, and other aspects that are not necessarily related to the permit, but affect how residents are able to live their lives in Chattanooga. So I want to introduce Bill Payne, city engineer, and his team, along with our consultant from HDR.
Thank you.
Good afternoon. I'd like to acknowledge we got several of our water quality staff here, both our management and our project management staff, as well as someone here from HDR. So we're going to go through this. I wanted to let you all know as we get started, we're not here today to talk about numbers. We're not here to talk about what those rates are now, what they're going to be, that sort of thing. So this is just to let you all know where we are in the process and what we are doing and have been doing over the last year, because this is a contract that started roughly a year ago. So this is we know that some of the council members are new to the council since the time this contract was voted on and started, and so because of that, we felt like this was an appropriate time to let you all know what work has been done and what the next steps are going forward. So just the items that we want to cover today, we're going to talk to you and let you know a couple of things that the Stormwater Regulations Board has some responsibility for relative to the rate study. Just a couple of real high-level items on the water quality program and its history. And then HDR is going to come up and they're going to go over some information about sources of revenue and expenditure and give an overview of what their scope of work has been in developing the work that we get, and then talk to you a little bit about what our next steps are. So under City Code, the Stormwater Regulations Board is established under Chapter 31. They've got several responsibilities that were established by that particular code. There are two of them that I've highlighted here for you. One is that the board has a responsibility to make recommendations to both the mayor and the city council to assure that the rates are fair and adequate in order to fund the stormwater program. They also have a responsibility to review and provide constructive comments to our staff relative to developing and implementing a level of service that's acceptable to the ratepayers. So they're there as a sounding board, and so those are two pieces. The Stormwater Regulations Board has gotten this same educational presentation. Many of their members are new as well since the last time that we went through one of these. I'll talk about the history in just a second. So we've also briefed them on some of the education, but we've not yet presented anything in terms of rates to the board yet. But that's what their role will be moving forward. So when we talk about some items, just to let you know where the water quality program started. Initially, that code in Chapter 31 was adopted in 1993. That also coincides with the beginning of a separate fee. Started out initially called a stormwater fee. Later on, the name was changed to a water quality fee. But all of that, all has its basis in some state code. So that started in '93. Beginning in 2003, we knew that we were not in compliance with all the pieces that we needed at that point in time, and so in order to help us move forward in terms of what were the things that we needed, we had gone through there had been a long period of time between starting the program in terms of where we were at both with regulatory compliance, talking with TDEC versus what the ratepayers were looking for. So we conducted a gap analysis in 2003. We then went on after that and actually went through a level of service, cost of service study 10 years ago, much like what we're talking about now. So this just lets you know that, and as part of that process, it started in 2006, ran on through 2007, ultimately resulted in recommendations to the city council, and our current fee structure, both the calculation method and the rates were adopted in 2009 and had some adjustments in 2010. And they were gradually increased. Those non-residential rates had a period in which they were ramped up over a 5-year period between 2009 and 2013. as well. So that was all part of the last round of this. So it's been 10 years since the actual level of service, cost of service study was actually conducted. And so this is just part of the periodic review for the health of the utility. So who is it that we're working with? HDR is the prime consultant on this contract, and Justin Bolander is here from HDR. He's their project manager. They are subcontracted with both ERC, which stands for Environmental Rate Consultants, and with SCM Engineering, and both the principals in those companies, John D'Amico and his brother Al D'Amico with ERC, and Steve McKinley with SCM. They have been involved and have been part of the original level of service, cost of service study. They are subcontracted and is submitted on this project as well. So a couple of things I'll mention, and I know at this point Justin's going to come up and go over some information relative to the project itself, but I'll highlight a couple of things that I know that he's going to get to, and they're highlighted there on the screen, just talking about some of the experience that ERC has. So, Justin.
Thanks, Bill. Yeah, I'll just, well, thank you all. Glad to be here. Good to see everyone. Just want to mention, particularly about ERC and Steve McKinley. These folks are financial professionals. They're the ones who have spent their careers doing this type of work all across the country, and they've been able to share their expertise here. And one thing you'll hear throughout my discussion is legally defensible rates, and just wanted to point out that their program, one of the programs that they helped set up, was challenged in a state court in Ohio and upheld. So you hear that legally defensible theme, throughout our discussion here this afternoon. So I'm going to start off with talking about the revenue sources for the water quality program, and then we'll talk about what that money is spent on, the different expenditures. So really on the revenue side, there's two sources. There's the water quality fee, which has been established since 2009 at a rate of $115.20 per equivalent residential unit, so basically per impervious area. And then the land disturbance permit fees, which constitute a smaller portion, which date back 25 years to 1993 at $30 an acre, disturbed acre. So let's talk about the expenditures and the responsibilities of the water quality program and what all of those revenue sources go into. So generally, when we talk about mandated responsibilities, we're talking about the Federal Clean Water Act, and we're talking about the MS4 MPDS permit, so the stormwater utility permit that the city is required to meet. So this is a list of items that generally comes out of the permit, and some additional items that the city takes care of as part of their regulatory responsibilities. So, for example, construction site runoff, that pulls in the land development program and what all they're responsible for. Illicit discharge detection, there's hundreds of those investigations, over 100 of those per year continually that has to be investigated and determined. Biological sampling, you'll see the map here showing these different sampling locations across the 8 watersheds. So there's various programs on the sampling side that have to be done on an annual basis and reported to TDEC. So that's just a quick summary of the unfunded mandates that are provided through the regulatory requirements for the program. So if we talk about other activities funded by the program, now some of these have overlap with the regulatory requirements, but some of them are based on meeting the city's vision and their mission of providing service to their citizens. The 311 response, for example, you'll see throughout these next 3 bullets there, any of those could have been instigated by a citizen request, and it may be that it's not due to that, but those have a common theme throughout all of these additional items that we're showing here. So for water quality issues, for example, it may have something to do with results of the monitoring that was done and having to react and have some sort of response to that. Drainage and flooding investigations, obviously there's issues with rights-of-way areas that get flooded and roadways and things like that, and it may involve field work or modeling. of course, there's capital projects, and when we think capital projects, we always think, construction, millions of dollars in construction. Well, you also have the management of the contract and the contractors and the inspection, the daily inspections. So all those things add up, and they're part of the responsibilities. On the operation and maintenance side, there's an infrastructure system, obviously, that has to be maintained. As far as conveyance goes, there's approximately 2,000 miles of conveyance in the city limits. And that includes open ditches, streams, and drainage ditches, but it also includes buried infrastructure. So part of that is pipe maintenance and catch basin and manhole maintenance. So the construction crews for those items are a big part of this operation and maintenance item, as well as the maintaining of the ditches and the streams, which require clearing to make sure that there's not overgrowth in those areas that are causing flooding and those various things. And then the part of that conveyance that's buried piping is approximately 650 miles. So each year there's a portion of those that's inspected, and then there's cleaning that goes along with that. There's responses to rain events to clean out the various catch basin and drainage structures around the city. So that just gives you a synopsis of what these other activities are. So what I wanted to point out here really is the number of staff. You can see them in the various different categories, and you can see the various activities that are associated with a lot of the things that I just talked about. But I just wanted to point out that as we went through our data gathering process, this is one of the things obviously that's considered, and we'll talk a little bit more about how those employees come into to the overall implications of the program here in a moment. So we've talked a lot about what is included in the Water Quality Fund. Well, let's talk about two items that aren't included. The wastewater side of it, the consent decree program, is really a separate entity altogether as far as the wastewater infrastructure maintenance. There's some small overlap there when you talk about combined sewers. There are some combined sewer separation projects that get done under the Water Quality Fund, under the capital program, but by and large, the wastewater infrastructure is a separate thing, as well as private property issues. If we're addressing flooding in regards to a 311 response, for example, then we're going to have to determine where that responsibility lies, and there are things like pipes and infrastructure on private property that are just not part of this program, that are not part of the city's responsibility. So I just wanted to point those two things out. Okay, so now that we've talked about the revenues and what all this revenue gets spent on, the responsibilities, we'll talk a little bit more, basically a bird's eye view of the rate study program itself. So there's a timeline associated with the program, and as Bill mentioned, it's a 10-year look ahead. So when we talk about the current level of service, that is based on what's being provided this fiscal year. And when we talk about the 2 5-year projections, we're looking at, as far as the study period goes, fiscal year 19 to 23, and then the next 5 years from 24 to 28. So to show you a little bit about the rate study process overall, here I really just wanted to focus on the red highlight there. The other areas I'm going to get into in the next slides here that lead up to number 6. But right now, we're at a point where we've been working for approximately the last calendar year, and we've got a draft version of that actually sounds better when I go a little closer, huh? A draft version of the results of the study. And we're here today to give you more of a bird's eye view of the program itself and of the study and what we've done. And we're in the process of reviewing the results with the Stormwater Board and with the administration, and then finally with you all when the time comes. So let's excuse me. Let's kind of start from the beginning here and just talk about how we developed the the rate model and all of the information about the study. So what I want to point out here is that we're looking and striving to make this a legally defensible rate projection and a legally defensible study to provide to the city. And to do that, we really start from the city's mission and vision for the Public Works Department and for the city in general. So this is really the basis for the plan that we put together to come up with the various goals for the program. So to get there, we started out with a data gathering phase, and mainly this started with a questionnaire to the various groups in the program and in-person interviews. And we were able to put together organizational charts that define each employee and then be able to understand the salaries and the benefits of each of those employees. We've talked about the regulatory requirements with the Clean Water Act and the NPDES permit. We also have total maximum daily load requirements, TMDLs, and that impacts some of the different watersheds in the area. And then once we have those two things, we can look at what all those people do. What are those water quality activities that they do, and how are those activities broken down into efforts for water quality and water quantity, or flooding and drainage, if you will. So one of those areas is addressing citizen requests. We were provided a database of work orders over the last several years. We're able to analyze those and understand what those different various activities cost from a standpoint of, how much does it cost to go and fix a broken pipe, or to repair a catch basin, or to repair a certain length of pipe, and be able to use that in a projection going forward into what the city will spend in the future. So we'll talk about that a little bit more. Obviously, revenue and budgets, we've talked about that some. We have final financial statements from the last several years and the budget for this fiscal year. And capital improvement projects, we leaned on the staff a lot here to give us a projection of what those projects would be for the next 5 and 10 years. Some of the more detailed analyses that we did on this data was these 4 listed on the bottom here. We've already talked a lot about the work order data and the capital improvements. I mentioned TMDL, so recent changes with the way development is handled in certain watersheds is going to determine how the city is addressing these total maximum daily load requirements for South Chickamauga Creek, for example. So there's additional capital projects that would need to be implemented because of those changes, and that's worked into this. And the land development program and how it operates is also, everything was on the board as far as, looking at how things operate and what the cost implications are for the foreseeable future in the next 10 years. So once we were able to gather all the data, we developed this business plan and developed the goal statements that really look at how the city meets all the goals for the water quality program. And once we understood that, we were able to also understand what the current level of service is. So that's the services that are being provided now. And the water quality program is providing services, to meet the vision and the mission and the goals of the city, as well as the regulatory requirements. So this required minimum level of service, the nomenclature that we've used here, that defines the next 5 years, and the future minimum level of service defines that period after that. So when I say required minimum level of service, we're not talking about doing the bare minimum. What we're talking about doing is meeting the goals of the city, meeting the expectations of what the city's goals and mission are, and meeting the regulatory requirements, and having the funding to do that. So don't get too hung up on that minimum part. What we're really just trying to say is that we didn't provide the Cadillac with everything you could possibly ever want to do in the next 5 years. It's more of a standard minimum that we need to do to meet the regulatory requirements and to meet the goals of the city. So we're able to apply costs to each of these goals and activities, and then, as I mentioned, consider the difference in water quality versus water quantity. So to make the projections, Environmental Rate Consultants has an interactive rate model that they've developed over the years, and that's really the basis for what we've used here. I mentioned about the final financial statements and the budget for this year was used to produce this, ERU-based rate and revenue projection for the next 10 years. I think I've mentioned legally defensible enough at this point. So topics considered that are included here. So the scenario is a pay-as-you-go type scenario. So we're not considering taking on future debt to accomplish the program or capital projects or anything like that. But it does include servicing that existing debt and existing bond payments and carrying that through. There's some programs that require additional staff to be added, and that's considered. Of course, we've already talked about capital projects. Some of the things that go along with that are construction equipment and the maintaining of that equipment, the increase in construction materials over a time period, inflation, those uncollectibles that are always worked in addition to revenue adjustments and credits for those that may have a tax reason to not pay the fee, or whether there's a credit for various properties that don't apply. So those are just a snippet of the background going into the study. So with that really summarizes what we did for the rate study, and I'll turn it back over to Bill here to wrap up.
Thanks, Justin. So as we mentioned on the slide that showed the process flow, there's been quite a comprehensive review of all the information that's there in order to make sure that we're looking forward properly. And so those next steps are to take this draft rate study that's in the process of being worked through. It'll next get wrapped up and finalized. There'll be a presentation onto the Stormwater Regulations Board. And then after that, it will continue through and come forward after that with City Council. So then there will be a process, obviously, of completing some reviews with administration as well throughout that process. So that's just all part of the normal course. But wanted to make sure that you all were aware, and we appreciate the opportunity to be able to provide you some information on the contract. So thank you.
Thank you, Mr. Chair. I may have two, one for Justin, one for Justin. Justin, can you walk me through the term, you mentioned legally defensible several times, and I need a little more, because it sounds to me like you're really trying to shore something up when you use a term like that. Can you take that a little further?
I don't mean to be exorbitantly alarming about that. And if Al D'Amico and John D'Amico were here, I'm sure they would chime in a little bit more than me. And they're the folks that have been doing this type of work across the country throughout their career. And of course, when you change rates, obviously there are people that may not be happy about that, right? So what I was just trying to point out there is that the program and the model and the efforts that ERC has done to come up with these rate projections has been contested in the state court and has been upheld. I think that's the main point I was trying to make there.
Okay, thank you very much.
Just to add to that, just one of the reasons why that's important for us is with the original adoption of a fee in 1993, Chattanooga also went through similar challenges in that regard. And so whenever we changed in 2009, we actually switched from a prior method that had been in place from 93 to 2009 to the current equivalent residential unit. And so that is a method that at the time ours was adopted, there were multiple ways of calculating it, and ours was not one of the most legally defensible, if that's maybe the best way to say that. So it's just one of those things that's always important, because you never know when somebody may suddenly decide that they don't like what they see that they have to pay. So
It happens a lot. Bill? All right, Justin, if I may, Mr. Chair.
Sure.
We can go back a few slides. Can you paint a picture for me real quick on the difference between when it's a city issue, we're dealing with water quality, and when it's a private matter? And what are the steps taking?
So that's probably better answered by Bill, who's been the stormwater manager, now our city engineer. But and it can get pretty complicated because we deal with a number of different problems, and each problem is pretty unique, from all the way from, you know, a flooding situation to a quality of water issue, or a development matter that Land Development Office would actually manage. But that is sort of evolved over time, and I know that early on we had done quite a bit more. One of the things I'd like to point out before Bill kind of responds to what do we do now, and I think that's probably the best answer we should give you, is kind of what we define as a private property, public property issue. But one of the things to point out is that the study that we've done will runs through several scenarios, and it's the it's our job to sort of evaluate what we should do for the overall public good, what that rate would involve to perform that level of service, but it can change. What we do today can certainly change, and it has evolved over time as it just takes money. So we know that things cost a lot of money to build these this underground infrastructure, and to improve the underground infrastructure takes a lot of support. It takes a lot of support from engineering and from our operations side. So while what we do today wasn't what we did many years ago on private properties or public properties, just the same as it's changed, it can change again. And you know, some of the scenarios that we've talked about actually make some significant changes to that. We want to brief you on that later, but I'd like for Bill to kind of answer, what does private property, public property, what do those problems look like today, and how do we address those?
And the reason I'm asking Bill is obviously District 4 is, we even have roads called shallow Ford running through it, so water is a huge issue for us out there. And I get a lot of constituent reports, of course, with many roads like Davidson, Mara, Davidson Road, yeah. And so I'm interested in how the determination is made when someone contacts and says, hey, I have a very serious problem. I need the city to come out and look at it, because that's usually the first sentence.
Right. So most calls are going to come in through 311, and they'll get routed to our drainage investigation staff that's in our water quality engineering. They'll then at that point reach out and contact the person. I've always been clear with staff that people will describe things over the phone. They'll send an email. Their way of describing it will use different words, different terminology, and I've learned over the years every case is different. So we do go out to look at all of them in order to figure out what's going on. Sometimes they are repeat calls, you know, that we may have been out and looked at before. But once we go out and look at those, we have a drainage policy, which is something that has been developed. It's been actually looked at and adopted a couple of different times by City Council, a couple of different iterations along the way, once in the late 90s and once in the mid 2000s. But those are they're the guiding documents. And at that point, from a flooding perspective or a drainage perspective, we're going to look at it and say, is this a situation that starts out on private property, and is it water running from one property owner to another? Is there water coming from a right-of-way or going onto a right-of-way that is involved in this? You know, where is the infrastructure? Are there easements that may have been given to the city, or are they just private easements that run through private property? So from the city's perspective, overall, just to give a very broad review of what that looks like, there is no state law that says you're responsible, you know, as far as something that clearly defines that. And there's also not anything in our city code that clearly defines that. Tennessee follows what's called common law of drainage, and it basically says water's going to land, and it's going to start from the top of the hill and run downstream, and every property owner is responsible to accept that flow and convey it to the next person downstream. So the city is in that sense, we have to deal with those public rights-of-ways, and we deal with whatever easements we have, but we do go out and make investigations in order to make determinations. We can provide some technical assistance along the way for folks if it's something that's not the city's, but again, there comes a point where we can do some of that, but then there's pieces of it where they have to do some work on their own as well.
Great, thanks, Bill. I think that outside of common law, that law is called gravity, but my last question is also, you were almost touched on it real quick. Once you're out there, you make a determination of the situation. What can the city do? Do we have a service, a resource, for example, hey, this is on your property, this is determined a private property issue. We don't just turn around and say, well, have a nice day. Is there, I mean, obviously, we don't want to get into any legal advice and how to handle your private property, but what do we do to help the resident property owner to mitigate what is happening in that particular case?
Sure. We can look at those, and whenever we do that, it usually comes in the form of, first off, we make that determination, is this a civil matter between two property owners? We may have some technical advice on, this is where the problem is coming from, and these are some ways that you could solve it. But sometimes, the issues are, my neighbor graded their yard and they directed all their downspouts right at my fence, and now my fence is washing away. They want us to step in and do something about that. Those are some things where we can, a lot of times we come out and look at it and we go, yep, you're right. Those downspouts are headed towards the fence post, and that's what's washing it out.
That was my phone call this morning.
Yeah.
Great way to go, Bill.
So
All right.
I didn't know
appreciate-
that, so I guess
I appreciate the information and always education from Public Works, especially when it comes to water quality. Thank you, Mr. Chair.
Thank you. Councilperson Burrs.
Legally defensible.
Yes.
So we got a very thorough education, and thank you very much for that. Legally defensible, and you talk about people complaining about their rates. Is this all preemptory for the rates are going up?
Not necessarily. This is just any sort of a rate review like that. The study really is the basis for the fee, and so this is a matter of making sure that what we do and what we look at, that there's nothing arbitrary, and that the amount of dollars that are needed for the program
Whatever
actually
the fee is.
correct.
So-
that the fee supports what's needed.
What is the balance in the water quality fund now?
I don't know that.
Can
I
anybody
don't
tell
know
me?
what that-
Daisy, could you tell me? It's usually a pretty large fund. How much do you have to keep in reserves because of the consent decree? Because you never know what's going to be
Well,
happening.
this is the water quality fund, and the consent decree is not connected to that. So that's
So
those
there
are-
is no connection with all the downhill running?
Correct, not with the water quality. This is the water quality program. Consent decree is funded from the waste resources from the Interceptor Sewer System Fund.
Okay, so when will we know about those fees?
Well, as I mentioned, in the next steps, we'll be finalizing and going through our reviews administratively and finalizing those rate services, and then we'll move forward to the Stormwater Regulations Board. They generally have they can meet once a month, so obviously we're looking to try to move those things forward over the next few weeks to try to get that moving forward. Hopefully the board can hear about that. And then after the board hears it, then it would come forward for city council.
And I guess the last question I have, and I guess this is for you, Mr. Attorney, Water Quality Board hasn't had a great record for attendance. Are we making sure, because this is such an important issue, that they are in attendance?
Thank you, Councilman Burrs. I think Bill and I have spoken about this, and we've actually forwarded a letter to his office to make sure that the recommendations are coming there, and I guess in addition to that, to make sure that the chair at least is in attendance at the meetings whenever something is on the agenda from them.
Okay, well, I hope there's something on the agenda. So we're going to have full attendance, and I noticed it still said that the board is advisory to the mayor and the council. I thought that had been changed.
No, I thought that The idea was to ensure that the recommendations will be made to council so that whenever there is an ordinance or.
Almost like planning
Like
commission.
planning,
Yeah.
there will be a resolution that would say, submitted by or approved by the Stormwater Board. So that would
Okay.
show up on the agenda with that notation.
Okay, so it'd be recommended by perhaps Public Works and recommended for approval by the Stormwater Board? Is that what that would read
Yeah,
like?
so I think, again, we wanted to make it like the zoning, the planning
Okay.
items, right? So you'd have one from staff, one
Sure,
from the board, if there were changes. Yeah,
okay.
but it could be the same one. too.
Well, yeah, that's fine.
great.
Okay, thank you.
Any other questions? If not, thank you very much.
Thank you.
Good report. And now we are going to adjourn this part of the meeting and move into a Youth and Family Development Committee meeting.
Hey, guys. We are going to hear today some more information from, I'm sorry. Sorry. I'm so excited about maybe you guys.
I know, right? She jumped right on in. I know, right? Can I get approval for the minutes, please? Thank you. All right, so now we're gonna have like a 15-second moment of silence, followed up with a prayer. No, just joking. Okay, so today we got a presentation about Baby University, one of my many favorite programs. It's on.
Guys, hey.
Turned it down.
Totally together here. So today we're going to hear a little more from Baby U. You heard me give some information about them a couple weeks ago, but we have the final year 2 evaluation from the external evaluators. So we're going to share with you some in-depth information, some research. Max Taylor is with UT's College of Social Work, Office of Research and Public Service, better known as UT Schwartz, and he's going to give an update and time for questions. So I hope you enjoy it as much as I do, and I'll turn it over to Max.
Thank you. Okay, can you hear me? Okay. All right, well, I'm Max Taylor. I have a Master of Public Health from University of Tennessee. I'm here on behalf of our director, Marianne Cunningham, and our statistician, Dr. Olga Ebert, and of course, Baby University, and I'm gonna talk to you a little bit about our findings from the first 2 years of the program. So thank you very much for having me. The period covered by this presentation is from August of 2015 to October of 2017, and we prepared the report this January. Here we go. On this slide, we have some selected Baby University program goals and the objectives beneath them. Families embracing healthy lifestyles and long-term stability and the objectives to achieve that, as well as children succeeding in school and life and the objectives to achieve that. The methods we use to gather this data include a client satisfaction survey, which we conducted via mail, statistical analysis of several assessment tools by Dr. Ebert. These include the self-sufficiency matrix, which measures the level of self-sufficiency of families. The Ages and Stages questionnaire is a tool used by pediatricians and other service providers to track childhood development. And then the Parental Assessment of Protective Factors is a tool that uses the 5 protective factors framework that assesses reducing the likelihood of child abuse and neglect in families and strengthening family environments to provide for optimal childhood development. And then we also have a health and safety survey that we developed in partnership with Baby U that assesses the physical safety and healthiness of the home environment. Here are a few comments about the Baby University population. As of October 31st, which was the cutoff date for the data included in this report, There were 124 active cases and 30 program graduates. This assessment data includes active cases, closed cases, and program graduates as of that October 31st date. Just as a side note, from the beginning of the program to the present day, Baby U has served a total of 245 families, 458 adults, and 577 children. This slide shows the racial composition of Baby U clients as of that date. 87 African American, 56% families, followed by Latina and Latino families at 28%, Caucasian at 10%, and then multiracial and Middle Eastern or Asian. The next slide shows the number of adults per family. There were 60 families with one adult, which is 39%. 61% of Baby U households have 2 or more adults in the household, and you can see the breakdown there, 68 households with 2 adults, 18 with 3 adults, 4 and 5 multi-generational families. The next slide shows the number of children per family, ranging from 9 with 0 children. These were mothers that were pregnant at enrollment. 38 families with 1 child, and 52 families with 2 children, all the way up to 1 family each with 7, 8, and 9 children. The next slide shows the pregnancy status and enrollment of Baby U mothers. 51% were pregnant at enrollment. Next, we have the breakdown of teen parents. There were 29 participants who were teen parents, which is 19%. This is a further breakdown of the teen parent data. Of those teen parents, 18 were pregnant at enrollment, and then of those 18, for 16 of them, this was their first pregnancy. Here we have a graph showing Baby U births at healthy weight, which is defined by the World Health Organization as equal to or greater than 5 pounds, 8 ounces. 8 babies were born less than that amount, but that included some twins, which automatically are expected to weigh less than single births even at full term. 59 of those were at or above healthy weight. There's information here on the side panels about the number of births and the number projected in November, and then there's updated information that we are currently gathering about the status of families since then that's currently being worked on by Dr. Ebert right now, who keeps texting me. Here we have a comparison of Baby U families' healthy birth outcomes compared to the state as a whole, Hamilton County, and then in green, the target zip codes of the program, 37404, 37407, and 37410. And this represents that 100% of Baby U mothers receive prenatal care prior to delivery, which is a very, very good finding. The next slide here is showing a similar comparison between the state, the county, the area, and then Baby U clients in terms of low birth weight and infant mortality. And as you can see here, the comparison is very favorable for Baby U families. I'd like to particularly call your attention to the infant mortality, that 0%, that is all babies that are born and born healthy. So that's a wonderful finding. Low birth weight is associated with increased risk of developmental and health problems later in life. That 12% represents the only 8 people mentioned before. So that's also a very good ratio. And then on the next slide, we have the status of the teen mothers enrolled in Baby University, 100% of whom are on track to graduate high school on time, which compares very favorably to the 53% nationwide figure. For the next graph here, I'm going to be showing the increase in the percentage of children on track using that Ages and Stages questionnaire tool from enrollment, which is represented by the gray dots, to the most recent assessment as of the writing of the survey, which is represented by the green dots. The Ages and Stages questionnaire pinpoints developmental progress of children between the ages of 2 months and 66 months in 5 key areas, which you can see above. It results in a score for each area, which are compared to cutoff points on the scoring sheet, which can be categorized as on track developmentally, monitoring, or with a need for further assessment. And as you can see here, there's an increase in all areas. The most significant increase that I'd like to call your attention to is in the domain of problem solving, which is the domain most closely related to future educational success. And this is the increase that achieved statistical significance for Baby U clients' children. So this is a very, very significant in all senses of the word outcome. The next slide shows in a similar layout the increased percentage of self-sufficiency for Baby U families. The self-sufficiency matrix tool enables practitioners and policymakers to assess the degree of self-sufficiency of their clients. You'll see in the gray box how for each domain, there are 18 domains of life and functioning, and for each domain, they can be assigned a scale from 1 to 5, 1 in crisis, 2 vulnerable, 3 representing basic self-sufficiency, 4 representing increasing self-sufficiency, and then 5 representing full self-sufficiency. And as you can see here, for all domains except for adult education, increases were statistically significant. The one note about this instrument is that these are areas which are identified by the Baby University specialist in partnership with the parent as areas of concern for them. So for certain areas like adult education, if a parent is at the level of education that they want to be at for their career, then they may not identify that as an area of concern for them. So for all of the rest of these, though, these are representing statistically significant increases as a result of membership in the program, which is wonderful. The next slide shows some of the other domains of the self-sufficiency matrix tool. It can be seen in this slide that community involvement represents the largest increase. And in this slide again, all but 2 of the domains demonstrate statistically significant increases. The only 2 that don't are the 2 that were highest to begin with, which is health care coverage, which naturally that's for many Tennesseans benefit from TennCare, and substance abuse, which was already in an extremely positive place for these families, where it was not an issue impinging on their lives. And here is another representation of this. So what we have there is from the first assessment of the tool on the left, the number of domains out of the 18 that the parent has as defined as in crisis. So the more areas of your life that you are in crisis, obviously, the more overall, well, the less self-sufficient you could be described as being. And as you can see here, from the first assessment to the most recent assessment, all of the domains, all of the areas decrease except for parents with 0 or only 1 domain in crisis, in which increases substantially. So this demonstrates in a graphic way that as a result of membership in the program, Baby University families are moving from less to more self-sufficient. They're moving in the direction we'd want to see. And this slide shows a similar arrangement with the parental report of protective factors. This is a series of 36 statements connected with the protective factors that have been found to protect against child abuse and neglect. Parents are asked to respond to a series of a series of questions in terms of rating them as being 0, not at all like me or what I believe, to a 4, very much like me or what I believe, and 4 being the maximum possible score for any item. These assess the presence, strength, and growth of parents' beliefs and behaviors that are indicative of these protective factors guarding against child abuse and neglect. And as you can see here, this slide is showing the increase in the number of 4s. So the number of parents responding that the maximum possible agreement with each statement. And for almost all of these, social connections, concrete support, and parental resilience, the increase achieves statistical significance. The social and emotional competence of children approaches it. So these are very good findings. And here is another graph demonstrating in a more visual way the movement as people move from low to moderate scores to high scores to maximum scores. You can see the number of low and moderate scores and the number of high scores decreases. Consequently, the number of maximum scores increases. So these are families that are strengthening the protective factors for their children. And again, this is demonstrating in a graphic way movement in the direction we hope to see. Here we have a comparison in the total median scores for the parental assessment of protective factors, and this is an increase from 3.7 to a 3.9 out of 4, which is very close, but does achieve statistical significance. So this is a very gratifying finding as well. This next slide shows the health and safety scores. These are areas defined. Emergency planning includes access to working phones, emergency numbers, emergency plans, and emergency supplies. Child-proofing includes making sure children are protected from common household dangers, and outdoor play includes making sure that any outdoor play areas are located safely away from dangerous areas and free from hazards like standing water or machinery. Structural safety includes making sure that the home is structurally sound and free from lead paint. Infant and toddler equipment includes access to safe sleep environments such as cribs, play yards, or toddler beds, and making sure that any baby supplies are properly heated and sanitized and used appropriately. And then health and hygiene includes routines for reducing the spread of germs and disease and keeping updated medical history records for all family members. All increases in these domains were significant, and all of them were movement in the correct direction. So this is another very gratifying finding for us. And here we see the increase in the total health and safety score from the first assessment in gray to the most recent assessment in green. And then finally, this slide is my personal favorite. Each of those dots represents a Baby U client, which we surveyed via mail or interviewed. The green people are people who agreed in the strongest possible terms with the 9 statements. All other responses are represented by the blue people. And as you can see, when asked about their relationships with their specialists, with their good match, can get in contact when needed, whether they would recommend the program to a friend or relative, and whether they were satisfied with their experiences with Baby University, 29 out of 30 responded in the strongest possible terms. So each of those people represents a mother or parent whose life has been directly benefited as a result of their contact with the program. And with that, I'd like to offer you the opportunity for any questions. Thank you.
Darren.
Thank you, Madam Chair. Thank you for those numbers. One of the very first things that I did when I was elected was to visit Donna and her staff at Signal Centers and paid special attention to what Baby University was doing. And I was very, very impressed with the vision at that time, and it's good to see the numbers that are coming in with this. So I appreciate that presentation. So my next big question for the entire program is really simple. Where do we go now?
I'll defer to Ms. McConico for that.
Thank you. It's good to be with you again, and I am standing up, so. It's like- yeah. The mayor took a picture of me beside him one time, and when he shows it on Twitter, you can either see him or me, but not both of us. So it's kind of, he thought that was funny. I did not.
I'll keep that in mind.
I just keep me on a step. We have a lot of things going on, and we've had, actually, since this survey started, one of the things that we have found incredible success at Howard High School is with our teen parents. And so we had a private donor who donated $66,000 for us to start the program at Brainerd. Wow. And we have done that. We started in January. And we now have 11 teens who are either pregnant, or the qualification for the program, you must be either pregnant or have a child under the age of 2. We're really trying to impact child outcomes. And we believe the best way to do that is by working with the whole family. So we have a 2-generational approach in everything we do. And so that's the next step for us. If we could hit every high school that has pregnant teens, I think that would be a great next step, because you saw the rates. 52% graduate from high school. And we have so far 100%. And I think we're going to see that again. The Brainerd, we met with all the staff of the counselors at Brainerd, and the counseling staff, they have 4 counselors there. They said, all of them said to us, basically, when a girl gets pregnant, we don't see her again. They couldn't identify one that graduated. And they have been so supportive, the schools have, to allow us to come in during the school day, give us a little time every other week. And then we also go to the girls' homes and meet with their mother and the father, whoever else is in the home. So that would be a logical next step. But our goal eventually would be that any parent who needs support would have it. Because when I look at the infant mortality rates in our community, 10%, 1 out of every 10 child born in East Lake and Alton Park dies before their first birthday. We got to do something. That's our future. We don't want to lose even a 1. And I think that we can do better. 7% in all of Hamilton County in Tennessee. So we're getting calls now about replicating this in other places. We've presented at a couple of national forums, and we think that this is a model. The next charge for UT Schwartz is to compare us to some of the other national models that are much more expensive. It costs about $6,000 to serve a family. Mm-hmm. And most programs, it costs $20 or $30, and we do in-home visitation. It's just not a visitation. We do everything. If they need diapers, we work to help the family establish their goals. We don't do it for them, and then work to move them towards advocating for themselves. And that's a unique task. So thank you for that question. Do y'all have any ideas about where else we should go?
Well, I appreciate your hard work and your dedication, and I tell you, it was very infectious when I was there to
It's a
visit with
great
you all,
program.
and it really is, and I can't thank you enough for your dedication to it.
Thank you. It's been a delight. We just don't say no. Councilwoman Coonrod came and spoke at one of our things. Several of y'all have been to other events that we've had, and anything we can do to inspire and help and encourage families to succeed, it's great. And y'all were one of the first encouragers when we started this program. Everybody on this council just said, yeah, if you can do this, we'll help you. So thank you.
Yeah. Thank you, Ms. Donna. Thank you, Madam Chair.
Russell.
Thank you, Chair. You said you are at Brainerd, or you're going to go to Brainerd?
We're at Brainerd now. We started in January.
Okay. And it's going pretty well?
It's going great. In fact, it's ramped up quicker. We usually try to get about 1 new client a week because we got to do a home. You know, you saw the list of evaluations we do on everybody there. And we are already to 11 in that case load.
Okay, I appreciate it very much.
It's great.
Councilman Byrd, I'm gonna let you talk today.
She talking so low all the time. She always speaking very loudly.
I know.
They got my mic turned down.
Oh, that's what it is. Okay. If some young people were inquiring about Baby University to me, a young pregnant young lady or with a child under 2, how does she become a part of the program, and what would what would be the process of getting a young lady into the program?
She just needs to make a phone call, and that's to our Signal Center's number, and it's the main number, and we will direct her to a person who will do an intake, and we'll take everybody. So as long as you're in our areas, we also take anyone who's homeless, no matter the zip code. The other thing that we quickly realized is that many of our clients are mobile. They may not stay in our zip codes. We don't drop them when they leave. So, but yes, we'll come out and we'll do a home visit. If they're comfortable with a home visit, we'll go to the home. If not, we'll meet them somewhere where they are comfortable, and then talk about the requirements of the program, because we ask people to step up. Let us come to your home. Let us go into your home with this assessment tool, and let's figure out what's safe for your kid together. And so we're pretty intrusive, you know. We want to know when your OBGYN visits are, and if you manage not to get your transportation scheduled with TennCare, we will go get you and take you to that appointment and watch the kids while you're in there. I mean, we just want to make sure that prenatal care is done in a very good way, because it's hard if you don't have transportation, you don't have other child care, you don't have support. It's hard to make all those appointments.
Very hard. Thank you.
Yeah.
Thank you.
Okay.
Councilman Good.
Great question.
Yeah, do you have a mental health component to the Baby University?
All of my case managers but 2 have a social work degree. And those 2 have either early childhood or a related degree. So the director of the program has a master's she has a master's in social work, which is what she's a lot of experience in counseling. There's one other one who has significant experience in counseling as well. She worked for Johnson Mental Health for years. So we have that element on our staff, but sometimes what we need to do is refer them for counseling. So we will find a way to either pay for their counseling or get a reduced rate if that's what's needed.
I appreciate that. Thank you.
We also, one of the things you didn't ask, but we do have 3 bilingual case managers, 2 native Spanish speakers, and 1 who can speak as well as almost anybody.
Thank you, ma'am.
Thank you.
Any other questions? Well, I just thank you guys for coming out and giving us this report. Baby University is an excellent program. The staff, man, is just exceptional.
They're amazing,
they just
aren't
go
they?
above and beyond. They all need a pay raise, but I've seen them just in the middle of the night take phone calls
That's
from
right.
the participants in Baby U. They stop immediately what they're doing to go take care of the needs of the participants. And that's what matters, when you have that mentor that's dedicated to making sure that you're successful. And, you know, they take heed to that. And then the fact that you're including the whole family. It's not just me being the team mom that's in the program. It's the whole family. And I've seen how it's working, and just continue, and hopefully that it'll be citywide, not just limited to certain zip codes. That's my hope of where
Your
it will
ears
go
to the
eventually.
budget's hard.
Yeah.
Your words then. Yeah, and I would say this too. One of the things you asked about was mental health, and that's a great question because it's such an issue. We've worked very extensively with lots of partners. Everything from, the Ladies of Charity give us money for diapers every month. They let anybody who gets a job go shop for free at their thrift shop. We have an amazing number of partners that work together to make this happen. Creative Discovery Museum last month let us bring everybody over there. We brought almost 200, counting adults and children, for free. And last year, they gave everyone who was participating a year's membership for free. So this isn't just Signal Centers or Baby University, it's everybody. And I think everybody wants the same thing for our families. We want them to succeed, and we want to provide them the resources they need to be successful. So we are very grateful for all that y'all have done and look forward to continuing. Thank you.
Thank you. Well, one thing that you didn't touch on is that we've heard a lot about the teen moms that participate, but you also have teen fathers.
We do. We have started a fatherhood initiative, and that has been we're learning, okay? I would say we've started a fatherhood initiative, and we certainly have worked with fathers who are in the families, but what we found is there's lots of dads at the schools who the mother of their child is not at the school, and we are working with them as well. We hired a fatherhood consultant, Brandon, last year, and sent him to some incredible nationally known training, and he is implementing that curriculum with the father. So thanks for pointing that out. That was great.
All right, any other questions?
Thank you so
Thank you.
much.
So we'll adjourn to 6.